Colon cancer is a preventable cancer in that it tends to develop in a certain orderly fashion. The patient has a normal colon, then develops a polyp, which is like a wart in the colon. That wart or polyp grows bigger and bigger and then eventually becomes a cancer. So if we can interrupt that pathway earlier, at the stage where it's a polyp, and remove that polyp, then we can prevent the patient from developing colon cancer. Because it's a preventable cancer, it's one of the reasons why we encourage patients to get screened.
Certainly, colon cancer screening is one of the most important health preventive measures that any patient can have. Sadly, colon cancer is the second leading cause of death from cancer, lung cancer being number one, and then colon cancer being number two. The best reason to have a colonoscopy is that you're totally asymptomatic, and it's a preventive test. When people wait to have their colonoscopies based on symptoms, oftentimes it can be too late.
Typically, at age 50, everybody who is in the average risk category should be looking to get their first colon screening.
If people have screening colonoscopies and have them on a regular basis to help remove colon polyps and to make sure that they're not developing bigger polyps, they can help prevent colon cancer from forming in the future. I think people's biggest fear in having a colonoscopy is just the fear of the unknown. Afraid of, what the procedure is going to involve and what will be found.
Once people have colonoscopies, they kind of see that it's not as big of a deal as they thought it would be.
Most people, once they get to recovery, say that now they realize that there was nothing to be afraid of, that the test is not what they thought it was going to be, and it's a very simple, quick test.
We have physicians here who do these procedures in very high volumes with a very, very, very low complication rate. Patients are very satisfied following their procedures. We have a very high rate of completing the procedures without the patient needing to have it repeated. And patients generally are satisfied with the experience. Not only the experience in terms of having the colonoscopy procedure, but also the experience with the staff.